Carlos Nelson with Cascade Media Group, and today we're going to be talking Black economics. We're going to be talking about mental health, and we're going to be talking about some serious women issues. And we've got Dr. Brown here that is participating in the Buy Black initiative with featured by the Kansas City Black United Front chapter. Welcome to the program, Dr. Brown.
Thank you. Thank you for having me. Appreciate that.
All right. This is my go-to line on everything. Tell our audience a little bit about yourself, and let's go back to kindergarten. And tell our audience a little bit about some of the people that helped mentor you, and that was significant in building who you are. And then we're going to talk about the Black United Front initiative and why you are involved with it.
Oh my goodness. So you're talking about decades and going back to so I'm actually I was born in Kansas City, Kansas. I was born in the old Douglas Hospital. I like to tell people I was born in segregated Wyandotte County. And so I came through at a time where we didn't realize a lot of the issues that were actually going on. But my father was a prominent Black minister in Wyandotte County, the Reverend Stevie Bailey, and he had a real heart for the Lord, but a heart for the community. And my mother was an educator, and she had come from Arkansas, was not able to have education. So education was really important to her. But I became involved in the civil rights movement even as a young kid, and I saw how a lot of the disparities, even within the white schools that I attended. So I was always that one kid that was asking questions you weren't supposed to ask, and I began to look for ways that I could help bring equality even within my high school, all of that. I ended up going to Kansas State University in journalism, thinking that would be a way that I could change the world through the print. And I began to learn that there were systems in place, even with that prevented us from really seeing equity the way we had hoped to see that. But during that time, I learned a lot, got married, had our children. We actually homeschooled as we had struggles trying to find a school that would really accommodate our youth. But I still found myself working in the community for ways that I could help bring that equity around. And about 18 years ago, I went to work for Kansas State University teaching nutrition pretty much in low-income housing. And there I realized that we kind of had it wrong. They were telling these women how they were supposed to eat. They were putting the fact that their children weren't doing well at school, that there were health issues. They were putting all of it on them, not recognizing they did not have the resources. So I did some of the seminal research asking women in low-income housing, women that were on SNAP, former food stamps, how they were actually feeding their families, what resources they had. And we learned some very key things. For example, you can't tell them to eat better, have fresh fruits and vegetables when there are no grocery stores in their area, and when it takes them 2 hours on the bus to go get groceries, and they can only carry 2 bags with the toddler. So we learned that we saw some systemic environmental issues going on within that. And we worked to begin to change curriculum, to bring them in, to hear their voices, to ask them how they could become better with the resources that they needed, not what we were telling them that they needed. And that work just kind of grew out. I began to work with organizations on how they could better be inclusive with all that were coming into their organizations, with what's called DEI work. And then when I retired as director of Kansas State Research and Extension as their director in Wyandotte County, then I continued to begin to do some consulting work with organizations to see how we could help employees better get along, especially when you're bringing different cultures together in doing that. But my heart has always been for African-American women in a society that has placed a lot of the burden of the health of our community and our own health on us. We have a lot of responsibilities. We're always caring for everyone. We're considered the, quote, strong Black woman. And yet we have the greatest number of health disparities that exist. Heart disease, diabetes, cancer, all of that is greater among African American women. And we now know that a lot of that has to do with the stress, being marginalized. And those are some things that we're really wanting to see how we can help empower people to change that. So on one end, I really help in addressing some of the environmental issues that create racial disparities, but on the other end, how can we empower ourselves to be able to take charge of what's going on?
So let's talk a little bit about the Black United Front's Black by Black initiative. Uh, why did you sign on board with that? And tell our audience where that's going to be taking place and date, the time. Give them a little information on that, and what you'll be doing at this By Black affair.
So yeah, I had to tell you how this was born. A lady sister, Sandra Newsom, came to me and she was like very concerned about what was going on with Black women, not outwardly, but some of the internal grief that we live with. She has had, you know, a very she suffered the death of her son violently. I had a death of a young child, and she was like, where's the space to address these issues for Black women? And from that, I talked to her a little bit and I said, you know, we could, I'm also working with the Kansas Birth Equity Network, KBEN, and their mission is to decrease the disparity of maternal health outcomes. And this would be one of those. And so we talked about partnering with them, and then she talked about partnering with the Black by Black initiative. And we all kind of came together and thought, well, this would be a great mission, because not only do we want to be able to provide economic power and buying among ourselves, but we also want to be healing. Wellness and health is threefold. It's physical, emotional, spiritual, and we wanted to have an opportunity to put all that together. So that was where we birthed the transformative women's experience that's upcoming on May 4th. And our theme is to rest, restore, and reset. And it's an opportunity, a space for Black women to learn what it really means to rest in their body, not just externally. How do you restore that? And how do we reset ourselves so that we can move forward and we can be a part of decreasing these disparities? We can take charge of that and we can be healthier as we are helping our communities.
When is this going to take place?
We'll be doing it on Saturday, May the 4th. From 10 a.m. to 4 p.m. And I'm really excited because we'll be teaching women some of the resources. They won't have to, some of them they don't even cost you anything. Some of the strategies for stress management and care don't cost you a thing, but we'll be teaching you how to do that. We have Chandra Green, certified trauma mental health specialist. They'll be doing our keynote speaker. She's going to be talking to us a little bit about the traumas. And we think about trauma sometimes as large, but many of us live within little traumas that have been built up. Many of us have generational trauma that's been going on. We don't even know it's informing the way that we show up every day. And so we're going to have an opportunity for us to really become aware of that, number one. And then we'll also be able to have a meal together. We know how important that all is. We have a massage therapist coming in. We will have, of course, the Buy Black initiative that we'll have vendors. And we're going to have something, I think, special too, sister circles, so that people can look at special issues of concern, whether that's grief, whether that is nutrition, whether that is their movement, whether that's caregiving, if you're a caregiver, little circles where you can meet with small groups of women to discuss some of the needs that you have there, some of the resources that are available, and just sometimes just an opportunity to kind of vent. This is a safe space where Black women will be able to come together and just take time for themselves beyond just that external.
All right. I think for now we've covered what's getting ready to take place. the when, the why, and the how. I'm going to steal one of my partner's closing. He always comes with this polite stuff. It was a plum pleasing pleasure having you on the show. I'm like, Jim, cut it out. I'm like, we snidely whiplash and we tie Sweet Nell to the train tracks so Dudley Do Right can come and unleash her. I love it. But it really was a pleasure having you on the show, Dr. Brown. And I applaud you for the work that you've done in our community and continue to do on the behalf of the community and especially women. And it's very important for our younger generation, our younger women, to see individuals such as yourself rising to a point and giving back. And again, it was a pleasure having you on. And as we always close, when you invest in your community, you're really just investing in yourself. Good day.
This is brought to you by Kansas City Business Association, working to improve our community.